Okay. Thank you very much for giving me the opportunity to present some aspects of my work on eating disorders from the perspective of body psychotherapy in our meeting today. I would like to start with a fairy tale of Snow White and the Seven Dwarfs. Mirror, mirror on the wall, who is the fairest of them all? This will be our issue today, and I would like, first of all, to introduce you in the instructional design of an experiential eating workshop on eating disorders for the target group of biosynthesis body psychotherapy trainees and psychotherapists of other directions, but also body psychotherapists, of a duration of 18 hours to 24 hours, which can be conducted on-site and or hybrid. It is experiential workshop with 2 levels of complexity. The first level concerns an introductory workshop for body psychotherapy trainees. The second level concerns a specialization workshop as further professional education for mature professionals, delivered in Greek language or in English language or in German language. And the learning objectives are to connect us personally to food and the manifestation of eating disorders on the mental health continuum, to make us acquainted to the theory on eating disorders concerning diagnosis, clinical reality, causality, and treatments, and to present a novel biosynthesis approach to the treatment of eating disorders. Interesting experience we had with that. Now, with regards to the thematic content, the workshop consists of 7 modules and the respective exercises. I just present you now the content because by following the presentation, we will not have the chance to see all the material, but we will focus on 2 or 3 of them. First of all, our relationship to food and the continuum of mental health. Second module, eating disorders, characteristics, and the clinical reality. Third module, causative factors of eating disorders, and followed by the vicious cycle of eating disorders. The 5th module deals with our topic, eating disorders and body psychotherapy. And the 6th, and I believe the most interesting module, concerns with a biosynthesis approach to eating disorders issues. And last but not least in importance, the identity and body of the psychotherapist. Connected to the theoretical approach with regards to the content, there are experiential exercises. A first group of exercises aim at the sensitization to the subject and to the connection of personal, affective, and sensory mapping of the field of eating disorders. There are 3 exercises in this field, all connected to the first module. And I will present in the following the first one, which is a brainstorming on feeling and sensing with regards to the topic of eating disorders. I will not present, but there is another one, an experiential exercise with the title Myself and Food, where we explore the meaning and the symbolism of food in our daily life. And at last but not least, the Food Explorer on an Unknown Planet, which is a meditation designed by John Kabat-Zinn with raisins, which is very interesting because we have the taste actually in the workshop. A very interesting next approach concerns biosynthesis interventions based on our life field concept and the main themes. It is the experiential exercise 4 with the title Frida Kahlo. It can be connected to module 2 or to module 6 Today, I will present this exercise to you connected to Module 6, and it deals with the simulation of eating disorder experiences. And experiential exercise 5, my favorite childhood food. It can be connected to Module 3 or to Module 6, and it aims at the activation and exploration of the food-related field in participants' childhood and family, which is also a very, very strong exercise. So I would like to ask you to sit very comfortably in your chair and just take 2 or 3 minutes to connect yourself to what you feel to the subject of eating disorders. I would like to ask you to breathe, take an intake breath, perhaps counting to 4, holding to 2, and in counting to 6 at the outtake, and just close the eyes, connect to yourself and to your body in the here and now. Continue breathing at your own rhythm, and just check how you feel and sense with regards to the topic of eating disorders. How do you sense your body? What feelings and what images do emerge? Please take 1 or 2 minutes. So unfortunately, I cannot see your faces in order to check how it goes. This is the negative of Zoom. When you are doing this exercise in the group, it is a very interesting introduction to the subject and to the field. And we do share in the group, each one word or one image. So I have now here some testimonies, but please write also what your experience has been in a piece of paper. Greek biosynthesis body psychotherapist trainees had the experience of fear, the experience of stress, the experience of craving, the experience of threat, of self-destruction, of entrapment, of immobilization, of delight, pictures of good and bad food, of hope, of life, of comfort, of vomiting, of tenderness. And you can please add, if you like, your own experience. If somebody wants to come into the discussion, I cannot see if there are hands, but if Nelly can give the floor, I would be grateful.
Yeah, I don't see anything, but...
Hi, this is Dimitris. It was a very upsetting image I had.
Mm-hmm.
It was dark and then empty.
Thank you, Dimitri. Somebody else who would like to add his connection to the subject?
I also had the feeling of bloatness and not with nice things inside.
Mm-hmm. Thank you. Somebody else?
I had 2 experiences. One was like entrapped freedom,
Mhm.
and the other one was discuss.
Thank you. As you see, everybody is connected to the subject. And this is what happens also in the group when we work on that. We are painting the field and the space of our experiences with food and with the disordered part, because our relationship to food is on the continuum of mental health, and it changes according to the phase of our life. So food is connected to the beginning, to the journey, and to the end of our early existence for everybody. Our connection with food begins through the umbilical cord in our mother's womb and ceases as one of the last functions before our final breath at death. It sustains our body and nourishes or torments our soul. Food is a means of secure attachment, of emotional exchange, and of warmth, or a field of negotiation, of combat, of dispute, conflict, or even violence. And in the continuum of mental health, as I already mentioned, and the embodied theatrical stage of eating disorders, we utilize food as the archetype of nourishment or as a symbolic symptom. So it concerned us all. And just to show you the beginning of the next exercise, we will not be able to go through it. This is the raising and the food explorer on an unknown planet. And there is the experience to taste just 3 grains of raisin and do the whole process of having it in the mouth, tasting it, and swallowing it. And then exchanging, of course, the experience in the group. Eating disorders are as well a clinical reality. And they manifest both psychosomatic and addictive dimensions. Eating disorders is one of the most deliberating mental health disorders with the highest mortality rate and an increasing statistical trend. Although they most rise in adolescence, nowadays eating disorders are encountered at all stages of life, bound to developmental process and its central challenges of self-actualization. Diagnosis of eating disorders includes 6 different categories, which are defined in the DSM-5 by using exclusive criteria, emphasizing on anorexia nervosa, bulimia nervosa, binge eating disorder. They are accompanied, all of them, by a high degree of denial and resistance to treatment and frequently relapses. And the tragedy is that food is a means of survival that we cannot be deprived of. We can finish using alcohol, we can finish using drugs, but we have to eat all the time. Let me just focus on the central emotional negotiation as I understood it or understand it all these years I deal with subject. Mirror, mirror on the wall, who is the first of them all, is the internal pursuit of the ideal self, mostly connected to anorexia nervosa. The conflict between the uncontrollable desire for immensement and the fear of annihilation, mostly connected to binge eating and to bulimia, deals with the issue of boundaries with the mother and others. Will she eat me or shall I eat her? And there is also the issue of the internalized anger and the calvary towards the death of emotions. Whenever I can't get angry at what hurts, violates me out there, I swallow it and destroy it inside me or spit it in connection with bulimia nervosa. Now, let's connect to our subject, body psychotherapy. Eating disorders are a dysfunctional mechanism for managing the relationship with our bodies, our emotions, and our environment. Concerning body, there is alienation, there is a disconnection from the body awareness and a rationalization. There is fear, disgust, already mentioned before by you as well, hatred, shame, fragmentation, and negative body image. Concerning emotions, there is avoidance, anxiety, criticism, and self-criticism, fear of oneself and others, and pressure to perform, high achieving. Concerning the environment and others, there is fusion or dissociation, hostility, and a strong longing for the past. What could the therapeutic goals of body psychotherapy be? A journey towards cultivating body awareness and self-awareness, strengthening self-esteem, aiming at restoring unity between body, emotions, and spirituality, leading to holistic embodiment. Now I would like to go forward to a biosynthesis approach to eating disorders. This is an attempt I made the last 10 years to connect the biosynthesis model and the method to the field of eating disorders. So when presenting this to body psychotherapist trainees, biosynthesis or from other directions, first of all, I introduce the identity of biosynthesis. I don't want to say many words to you because you know this very well. So it is a psychodynamic body psychotherapy tradition founded by David Bordella, perceives the individual as a mental, corporal, emotional, energetic, and spiritual whole being. Therapeutically, it is a self-formation process based on the life fields, and I explain the life fields, and it encompasses 9 main themes, and I explain the 9 major themes we have in biosynthesis. Then I present the life fields of experience. I have borrowed this from the biosynthesis.org internet site. And then I move forward to present a theoretical and experiential novel biosynthesis approach to address eating disorders issues in diagnosis and in therapy, where I use the model of the life fields, and I suggest a way of organizing therapeutic interventions on the basis of the 9 main themes, methodology, and techniques, engaging in a healing journey from the injured and fragmented self to the embodied self. Now, there is a testimony of a very close person in my life field. Imagine that your greatest enemy is inside you. This touches me a lot, and this brings me to a heart connection and to a body connection to the injured and fragmented self. The self arises mostly from a psychological trauma, a perinatal or in early childhood, early developmental stage, which involves most of the time the dual regulatory relationship between caregiver and child, leading to deficient self-regulatory capacity and corresponding defense mechanisms. And it is related, in our language, to character structures with situate and or oral characteristics and or rigid elements and the corresponding defenses. And let me show you a picture that touches me as well. It has to do a lot with the feeling of shame and fragmentation, and it has to do a lot with the eyes looking at the world and trying to get to have a look and an insight in the psyche and in the body. So the symbolic negotiation of the injured and the fragmented self, as I understand and sense it and feel it in anorexia, is dancing the tango with death. In bulimia, I spit what I can't get enough of. In binge eating, there will never be enough food out there for me. And in orthorexia, which is not contained in the DSM-5, but I meet it in the praxis, what is perfect out there is only good enough for me. So let's try now to use the model, our model of the life fields, to proceed to a sort of diagnosis. In life field, there is imprisonment, life field 1, it's imprisonment of the in the body. The person is in a prison in its own body. In space, has restricted mobility or compulsive hyperactivity, muscle hypotonia or hypertonia. In life field 2, overly controlled or chaotic breathing and mouth and throat area discomfort. Life field 3, abusive and or depriving experiences in relationships with others, avoidance of commitment or contact, or the exact opposite, merging enmeshment with the other. Lack of choices, the feeling of lack of choices, and disempowerment. Life field 4, self-dysregulation, lack of confidence in one's body and self, low self-esteem, confused emotions, criticism, lack of self-acceptance, disconnection from needs, reduction of self into image. Life field 5, alexithymia, not finding the words, confused and or obscure speech, focusing on or avoiding food issues. Life field 6, restrictive and compulsive thoughts and obsessions about the body, food, exercise, consuming extensive energy and time. And life field 7, awareness of the self focused on individual, fragmented body parts. Here, a person is only the belly. A person is only the hands or the foot and so on. There is a full identification with the ED pathology and its symptoms, and illness has become an identity. There is lack of connection with the core and the wisdom of the body, and there is an immense death drive. Now, when we try to approach eating disorders therapeutically, there are some key themes which are also polarities very known to our work. Control versus autonomy, vulnerability versus strength, boundary setting versus regression, trust and neglect versus neglect, and oversensitization versus numbness of body sensations and psychic pain. And the therapeutic goals we could set concern stabilization, body awareness, boundary setting, safety, respect for needs, tolerance, individualization, and spirituality. Now, it is important to say about the therapeutic approach is that eating disorders are a pendulum swinging between the threat of life and realistic therapeutic goals of reducing symptoms and introducing a new perspective on alternative ways of managing dysphoric emotions. Relapse is here an opportunity, and therapeutic alliance is very, very crucial because it has strong dynamics of transference and countertransference, competition, hostile feelings, resistance to change, and high pressure to perform due to the risk of serious complications. So in eating disorders, as we have to be, as therapists, very aware that therapy follows a labyrinthian journey from the injured, fragmented self to the embodied self. And it is like this picture, a very narrowed way in the wood from fighting against oneself to an embodied personal alliance. So the therapeutic alliance has to be interjected in an embodied personal alliance. So for me, it was very important to connect this approach and this try to the wisdom words of David. And in the literature, I found the path of the body, where for eating disorders is grounding, cultivating, and improving openness to body sensations, regaining body awareness, and establishing a coherent bodily self. The path of the heart, improving contact with emotions, balancing mental processes, developing empathy and compassion for oneself and others, and healthy boundaries. And the path of consciousness, connecting and balancing inner and outer ground and transforming the fragmented self towards wholeness and the core of existence to essence. So I have just 5 minutes more, but I would like only to present to you the 2 exercises. The one is connected to the path of the body. This is experiential exercise 4. This is this exercise, this picture of Frida Kahlo, which aims at the simulation of eating disorders related experience in emotions and the body, and cultivating and improving body awareness and self-regulation. The other exercise I'm working with in this part of the workshop is the path of the heart exercise, the experiential exercise 5, my favorite childhood food, which aims at the activation and exploration of the food-related field in participants' childhood and family, and developing empathy and compassion for oneself and others within healthy boundaries. So the Frida Kahlo exercise, it's important because it contains and connects to field 2, 4, and 6, and introduces a transformation via grounding, centering, and facing. We can work with that as an individual work and then process it in pairs, but it can also build the ground to develop a real therapeutic session. Unfortunately, I don't have the time now due to restrictions of the program to present it to you and go through with you and experience this exercise. There are 2 important issues here. The one is we feel our body and our feelings and images starting with discomfort, and this picture can help us to connect to the immense physical pain and the immense emotional pain. And then we search for another part in our body where there is a more positive or neutral experience, and we build the bridges. This is a known exercise, an experiential exercise from Biosynthesis, and here it is implemented on the field of eating disorders. Let's go back to our life fields, to our healing journey, when we come from the fragmented self to the embodied self. So life field 1, we work with affective motor process involving muscle and tone movement in order to come to liberation and autonomy in space and time. On life field 2, we work with energetic process with breathing to come to self-regulation. On life field, we work with family issues and relationship issues to come and create a meaningful personal history. In life field 4, we work in a psychoenergetic process, and we aim to move from the self-restraint to emotional release. On life field 5, we transform cognitive processes from limiting thoughts, mental patterns, and images to personal vision. And on life field 7, here happens an embodied spiritual transformation towards the essence, towards forgiveness, self and others, and compassion. A last issue, a very important, I think, for us. The identity and the body of the psychotherapist is in the field of eating disorders a very crucial one, because the embodied therapist acts as a self-aware catalyst in a particular complex and often frustrating high-risk therapeutic process. The therapist is a solid and structured receptor, holding and transforming intense and ambivalent emotions and physical sensations, and a sensitive creator of opportunities for focusing, grounding, mirroring, reversal, self and other regulation, revitalization, and integration. And the therapist is also a point of processing of enactments and transference and countertransference experiences. Here, there is also another very important exercise working experientially on somatic countertransference. It is very important for us to cultivate personal boundaries, reflect, be honest with ourselves and the client, and have self-protection. And there is a need for great openness to reach out to interdisciplinary support and supervision. The end of the journey in eating disorders is always a beginning, and I would like to share with you a testimony. So many years scattered, dispersed. Today, I feel grateful knowing there is something else beyond my appearance. It is not my appearance that defines who I am. It is what I feel inside my body, myself. Today, I need to honor the person I feel I am. So, thank you very much for your embodied presence. There is also some indicative bibliography. And I want to thank you very much for having the patience to follow this presentation.